Welcome once again to an Unknown Hero series on this channel, TIC Hub. So today we are delving into the health sector of Takoradi, and you know that as a channel we're always promoting Ghana and Takoradi in particular. So today we get to talk to one person who was at the forefront of the COVID battle in the Western region. And I guess we've all heard about the Effia Nkwanta Regional Hospital. This is the only referral hospital that serves Western region and even beyond. And today we are going to talk about Dr. Tambil and what he's done so far in this region. Welcome, Dr. Joseph Kojo Tambil.
Thank you very much, my good friend.
Thank you so much, and thank you for having us.
Thank you.
So this is a TIC Hub channel, and we want to always change the narrative about Takoradi and everything in Takoradi.
That's right.
And that's why we want to have you this afternoon to have this conversation. So before we begin this conversation, who is Dr. Tambil?
Well, thank you very much. Dr. Tambil is, should I say, a middle-aged man, born of very humble parents from the Upper East region of Ghana, a place called Tongo.
Okay.
Incidentally, I was born in the Eastern region. I lived there for some time, went back to the north, and then came back again to the Eastern region. I lost my old man when I was just 1 year old, and incidentally he died here in Takoradi and was buried here.
Wow.
So I would say that I do have some connection with this place, you know, right from my family roots, you know. So basically that's who I am. Like you said, I'm the medical director of the hospital. I am a public health physician specialist, and I'm married with 4 beautiful kids, and somebody who has a lot of passion for healthcare, especially the management aspect of healthcare.
Great.
So basically, in a nutshell, that is who I think I am.
Great. That's great. I would ask, how did life begin for you, especially with who you are today? Looking back, how would you say life began for you?
Life was very tough at the beginning.
Yes.
Like I mentioned, my parents were both illiterate, and to make matters worse, my mother was saddled with caring for 4 of us because my dad passed on just a year after I was born. And my dad was a polygamist, so he had 3 wives, and there were 18 of us.
Wow.
Yeah, so that tells you he left, even though he was a bit well-to-do, he left practically nothing for some of us. Okay, so life at the beginning was really tough, really tough, and I have my mother to thank for all that I have been able to achieve. So, well, life was tough, but in all that, I think what it has molded me to be is somebody who has learned the value of humility, and the value of hard work, and the value of getting everybody on your side, being able to work with a lot of people, you know, respecting everybody as a human being. So those are the good things that I took from those humble beginnings, and I think they've served me pretty well this far in life.
Let's talk about your education.
Okay.
How did it begin?
Okay, so I started primary school in Tamale, at a place called we used to call it the Hilltop. Hilltop Primary School. Okay.
This was in which year?
In Tamale in 1980. 1980.
Ago.
Yes, I started primary school in 1980 when I was 4 years old.
Wow.
Yes, because my mother desperately wanted me to go to school, so they sent me to school. Primary 1, when I went, they didn't accept me because they said I was too small. So I had to wait for another year, and then in 1980 I was accepted. And those days there was a simple way to determine whether you were old enough to go to school. So they would let you put your
so much about that.
Yes, I did that. Yes, you had to put your arm across your head to see whether it would touch your ear. So The following year, that's in 1980. I started in 1979 when I was just 4 years. And in 1980, I finally passed. So I entered primary school, but I didn't stay there for long. I had to move on to other places. So in 1988, I finished primary school at a place called. So I moved around quite a lot in those days, because my mom found a job at the local council in the north end. So she had to be transferred around a lot, and I moved along with her. But I finished primary school in 1988 and entered secondary school, Ghana Secondary. I don't know if you've heard about it.
Ghana Secondary School.
Ghana Secondary School. It's a great school. It's the same school that has produced people like Abedi Pele, like John Mahama, and a host of very prominent Ghanaians. So I was fortunate to have gone to that school. I did O-level in that school, finished in 1993. And then I moved on to Kumasi Tia Ahmadiyya Secondary School, where I did the A-level. Finished A-level in 1995. Those days you had to do national service for a year after A-level before you could progress in your educational career. So 1996, I was supposed to enter the university. Unfortunately, there was a university lecturer strike. So we stayed on at home for an extra year. But that year for me was a blessing, because I did a lot of work. Because, but for that 1 year of waiting, I wonder how I would have entered the university. Because it was around that time that the government had introduced what we call academic facility user fees. Those days, before that time, you entered the university without paying a dime until you came out. But it was around that time that the Rawlings regime decided to introduce that fee. So that year of waiting served me a whole lot of good, because I was able to work hard. I did a lot of teaching around, and then we had some menial jobs and all that, and I saved a lot. And so when I went to Legon the first year, I paid my own fees. I bought every single thing that I needed for school, and I actually lived on that money for an entire year. So it was a good thing for me. So I entered in 1997 to the University of Ghana, Legon. I was in Mensa Sabah, specifically the place called Opunglo. I don't know if you've heard about it. The Republic of Opunglo. We're the only people who defeat the Vandals.
I was a Vandal, so
Oh, really? So I'm sure you heard of the Battle of Vandaloo.
Sure.
Yes, I was there. I fought in that battle, unfortunately. So I entered the University of Ghana. Those days, you had to get into the university, justify your inclusion. To get into medical school, so God being good, I got the medicine. So 1999, we moved on from the main campus in Legon to Kolebu to do medicine. So that's how the medical story began. I eventually finished medical school in early 2004. And moved right away to start my housemanship. So housemanship, I chose to go to the VRA hospital in Akosombo. That's a very beautiful hospital, very small, neat, well-equipped hospital. So I think I had a good beginning in my medical career. That was
before you continue with the housemanship story. Had you always wanted to be a medical doctor?
Oh, not really, and that's what people may find curious. I wasn't like one of the boys who had the mantra medical or suicide. No, I didn't have that. I was it was peer influence that got me into medicine. Interestingly, one of the careers that I admired a lot was journalism. I actually wanted to be a journalist. Yes, but for the influence of friends. Another career that I really admired is teaching. And I think that is not late yet. I believe that later in life is something that I will pick up again, yes. So those are the things that I grew up admiring. But like I said, through the influence of friends, I ended up in medical school.
Okay.
And so
That's
here we are.
Great. Let's go back to the housemanship story.
Okay, so I did my housemanship, my first year of housemanship at Effia Hospital in Kosombo. That's in 2004 and 2005. Then I moved on to the regional hospital in Koforidua, which is another very good hospital, one of the best regional hospitals in this country. And I did the second year of my housemanship there. And I remained in the region after the housemanship. And I remember that when I finished housemanship, all the district hospitals wanted me.
Wow.
My regional director he called me, he was like, what was going on? Why is it that all the medical superintendents were coming to his office and saying that they wanted this particular house officer, you know? And I think I told him it's probably grace.
Yeah, grace.
Yes, yeah. And so I ended up going to Atua Hospital. Atua Hospital is in the Lower Manya district of the Eastern region. So I did 1.5 years there as a medical officer.
Okay.
And then there was an opportunity for somebody to take on a responsibility at cadet.
Okay.
Those days, cadet didn't have a hospital. It was a health center.
Okay.
And they were looking for somebody, a doctor, to start.
This was in which year?
That was in 2008.
Okay.
Nobody wanted to go. So for like a year, the project had been suspended because no doctor wanted to go there for whatever reasons.
Was it a remote area?
Cadet is not that remote, but the roads were a little bad. And I think the staff there were a bit hostile to doctors who came there. I think so. So that's why most of the doctors stayed away. But they approached me, and I decided to go have a look at the place. When I went there, I saw some of the reasons why nobody wanted to go. Because to start with, you didn't have a theater, there were no wards to admit patients into, no laboratory. Basically, there was nothing that you could start a hospital with. And so if you are somebody who gets easily discouraged, you wouldn't want to go there. But I looked at one bright side, because I saw that the attendance there was quite high, especially on market days. People wanted to use the facilities there. I think it was one of those old-time health centers, and it appealed a lot to the people in the community. So I said, well, herein lies an opportunity, because with people you can do a lot. So I thought about it, and I went straight the following day to the regional director, and I told him that I will go. And right there and then he wrote my postings letter.
This was a place no one wanted to go.
Nobody wanted to go. So when I said I will go, he didn't want to wait so that maybe I'll go and change my mind. So immediately he wrote my letter and handed it over to signed and handed it over to me. So well, I went, and thanks be to God, within 3 months, the place that didn't have a ward to admit people, we were able to make spaces available to use as wards. We were able to get a place where we could equip and make it a theater. We were able to get a place where we could expand the space there and make it a laboratory. And within 6 months, the place was running as if it was, it was an existing district hospital. And so we became like a tourist site for anybody who wanted to see how health management, at its rudimentary level is. And so, so that's how I started my managerial career, and I think Since 2008, I have never looked back.
Congratulations.
Thank you very much.
So it means that this place that no one wanted to go to actually turned out to be a miracle.
Exactly. That was I think that decision to accept that responsibility for me is what has set me apart from a lot of people of my age and even my training. You see, I'm not young, but a lot of times people see me and ask me, but how did you, because when I came here I was just 45 or 44, so I was relatively young, not so young. So people ask how I got to become a director of a major regional hospital in this country at that age. Well, I think it's from the beginning. It's how early I set off, and then how I was willing to accept the challenges that others were not willing to. Yeah.
So from cadet, where next?
Yeah, so cadet, I did 5 years there.
Okay.
And I'm happy to say that by the time I left cadet, we were actually winning awards.
Wow.
Yeah, from health center. We were being adjudged as one of the best performing district hospitals in that region. And
it actually tells that nothing is impossible.
No, exactly. When human beings decide to do things,
they can do whatever is set their minds to do.
Exactly. Yeah. So I left cadet on my own volition. I wanted a change of environment, and I was granted that. So I was taken to another district hospital called New Tafo Government Hospital. That's very close to Takoradi. That's where my family have always been.
Okay.
So I wanted to get close to them, and so I went to Tafo, and a lot of good things happened also.
Okay. So still as a medical director?
Still a medical superintendent.
Okay.
Yeah. We use the terms superintendent and director as a step apart.
Okay.
If for the district hospital level, you are a medical superintendent, and at the regional hospital level, you are called a medical director.
Okay.
But practically, it is about the same position. You are the head of the facility.
Okay.
Yeah.
So in Tafo, you were still the medical superintendent.
I was a medical superintendent for about 4.5 years before I came.
And then eventually came to Takoradi.
I came to Takoradi, yes.
Effia Regional Hospital.
Yes.
That was in 2019.
2019, yes.
Tell us about how all that happened, coming to Takoradi.
Okay, so I basically had never stepped foot in Effia Nkwanta Hospital before. I'd known Takoradi.
Had you been to Takoradi?
Oh yes, several times before. I had family here.
Okay.
Whom even as a student I used to visit from time to time.
Okay.
And I also came here for programs. Even in 2017, I was here for the Medical Superintendents Congress.
Okay.
At that time, I was the president of the group.
Great.
So we had it at Akroma Hotel.
Okay.
Part of the program then was to have a visit to Effia Nkwanta Hospital, but I didn't come.
Okay.
I never knew.
You never knew you were going to come back here.
Yeah. So they came to have a visit at the facility, because this is an iconic hospital in this country. So people came to have a tour around. I didn't come. Then 2 years later, I had applied to go to Tema General because there was a vacancy there.
Okay.
And I went for the interview. I was chosen, and my letter for posting was almost ready. Then I got a call one afternoon by Director General, and then when I got there, he and the Director Human Resource. They were apologizing to me that they had to change my posting. Initially, I thought they were going to say that, oh, sorry, we think that we can't send you to Tema any longer. But they were like, oh, we're changing your posting to a different place. They didn't mention where. And they wanted to know if I will accept it. I said, well, anywhere in Ghana. I mean, for me, Ghana is my country, and anywhere that I feel, you feel that you needed my help, I was ready and willing to go. So I accepted. And then when I accepted, they told me it was Effia Nkwanta. I left the room and I was like, damn, what did I just do? Because look, everybody told me not to come. Everybody told me, and I mean, for obvious reasons, there were so many challenges at that time. So many challenges. The management then was going through a turmoil, and so that's how come they had to do that switch between Tema General and here. And people said I shouldn't come, but I'm glad that I did because having made that decision, I have a lot of fulfillment right now because we've made some very modest strides. We are not where we want to be as a hospital. We are not there yet. But I can say that in the 3 years that I have been around, there's visible progress. And I think the staff morale is very high. I see a lot of togetherness, a lot of unity of purpose. And people are willing to at least die a little bit for this institution. And the public is seeing it. I get a lot of calls, people telling me, oh, you know, they were in our wards or they came to the OPD or came for one service or the other, and they encountered very good customer service from our staff. And for me, that warms my heart. And I believe that the decision I took was the right one. Yeah.
Before we continue with the Effia success story, do you think your beginning somewhere in Upper West,
Upper East,
sorry, and how you were brought up? Do you think it's kind of nurtured you to survive under any circumstance wherever in Ghana?
Absolutely, absolutely. You see, the thing is that when you have gone through a lot of hardship, it makes you wise. It makes you wise, and it makes you appreciate things.
It's true.
It makes you appreciate the little things that you encounter. It makes you not easily write off people or easily treat people in a negative manner. And I think that those things are the things that have kept me going up to this level. It has also taught us a lot of honesty. You see, I always tell people that, look, I've lived through poverty, so I don't really fear it. And so I'm not in a hurry to make money.
Yeah.
You see, I am not, even though I like it, every human being wants, you know, to have something and to be able to leave something behind for their children and their dependents. But that's not an overriding objective of life. You know, we want to see that when we are going, people would say something good about us. For some of us, that is the overriding objective of life. So I think the upbringing, has a lot to do.
A lot.
Yes.
Okay, so Dr. Tambil, let's talk about the history of Effia Nkwanta. How did it all start?
Okay. Well, the history that I am aware of is that in 1938, just around the end of the Second World War, there was this facility that was serving as a hospital for the British frontier, the armed forces also. And this hospital, or this health facility, was meant mainly for screening and treating soldiers that were trained across West Africa, who were being taken out to Europe to take part in both the First and the Second World Wars. And I hear Takoradi port was the main departure point. So these soldiers were brought here and then screened. Or those who fell ill whilst undergoing training were hospitalized here for treatments. Now, towards the end of the Second World War, when the British government felt no need to have such a facility here, they opened it up for the general population to be able to use the place as a community hospital.
Okay.
So, like I said, in 1938, it was opened up, and there was a small hospital in Sekondi,
Okay.
which had the staff. These staff, the equipment that were there were transferred from Sekondi into Effia Nkwanta.
Okay.
And that's how come the facility started.
Okay.
But when at the beginning, the facility was mainly the OPD area downstairs, down in the valley, and then a few wards up here. Through the 60s, during Nkrumah's time, and the 80s and the 90s, other facilities were added on.
Okay.
So if you look at the buildings, you could see the very old ones are all roofed with asbestos.
Yeah.
Those were the pre-colonial
Okay.
and the buildings in the 60s. From the 80s, newer buildings came on. So the older buildings are more towards the south and downhill. Then in the 90s, this building, the tower building, that's where the maternity block is, the theater block, as well as the CT scan. And then downstairs you have the CCC, that's the Comprehensive Care Center, the physiotherapy, they were all added on later in the 90s and the 2000s. So these are the newer buildings. But all the old buildings have asbestos roofings. And most of them are just a flat building or a one-story building. Yeah. The newer ones are the high-rise buildings that we are seeing. So I'm told that the tower building was completed in 1995 by the then Rawlings regime. Unfortunately, since 1995, there's been no major rehabilitation of the hospital up till now. So, like I said, I'm grateful that the current administration has deemed it necessary to come up with this redevelopment project to make sure that the facility gets up to the level that it once it once was. It used to be an iconic hospital. Unfortunately, other facilities have overtaken us.
Okay, Doc. So still on Effia Nkwanta, can you kindly tell us about the structure of the health system in Ghana?
Okay, thank you very much. I think I keep referring to Effia Nkwanta being a secondary facility or referral center. It's important that you ask that question. Okay, so basically our healthcare system is at various levels. And at each level you have the kinds of facility that go with that level. So basically at the sub-district or the community level, there are facilities that work in that niche. And these are the CHIPS compounds. So you go around and you see that there are facilities that have been labeled CHIPS. CHIPS means Community Health Planning and Services. These are small facilities with nurses or community health workers stationed there, nurses or midwives and community health workers stationed there. They have small compounds where they can do basic things like care for people with minor ailments. They also go out into the community to educate people on health issues and so on. Okay, so that's the basic level. That's the smallest or the lowest level of the healthcare system in Ghana. That's at the community level or the sub-district level. Then you move up to the district level. At the district level, you have a district health directorate. And alongside the district health directorate, you also have district hospitals. But these district hospitals are fed, they are the first level of referral.
Okay.
And they are fed by the CHIPS compounds,
Okay.
and then health centers. The health centers are like smaller hospitals, but they don't usually have doctors working in them. When they have a doctor or two, then we call them polyclinics.
Okay.
But they have very little to work with. They may have a theater or not. They may have a few midwives, a few nurses, probably a small accounts unit, maybe without a health service administrator. Now, this is where the first cases of ill health, accidents or whatever are reported to. Usually from the CHIPS compound, people are referred to the health centers. In some cases, they are not health centers, but they are clinics.
Okay.
Now, you usually expect to have a physician assistant or maybe a senior nurse or a midwife manning these centers. But in a few cases, you may have a doctor. Okay. So they in turn refer their cases to the district hospitals.
Okay.
Now, a typical district hospital has a doctor in charge, and then may have several other doctors working in them. In some few district hospitals, they are lucky enough to even have specialists in the four main areas, like obstetrics, gynecology, child health, internal medicine, and which is the other one? I think I've mentioned the four, right? Okay, so the four main clinical disciplines. But, they may have a proper management setup with the hospital administrator, pharmacist, accountant, nurse manager, and so on. So that's a typical district hospital. They may have a theater, but they usually have a theater to operate with.
Okay.
They have a lab setup, X-ray, and all that. Okay, but they usually do not have the subspecialties.
Okay.
Now, the district hospitals in turn refer cases to the regional hospitals.
Okay.
And typically you have one regional hospital in each region, except for maybe Greater Accra,
Okay.
where they have two regional hospitals,
Okay.
that's Tema and Ridge.
Okay.
Okay. Now, at the regional hospital, you have all the main specialties. That's the obs, gynae, internal medicine, child health, and I think, yeah, and so all the clinical disciplines are there. And then you may also have the subspecialties. So you may have eye, ENT specialist. You may have mental health specialist. You may have dermatology. You may have neuro and all that there. Okay, but at that level, you still are focusing mainly on care of patients,
Okay.
rather than teaching. You receive students from across, but you do not have a primary obligation to train.
Okay.
Okay, so that's what sets the regional hospitals apart from the teaching hospitals.
Okay.
So the teaching hospital, in turn, is a bigger hospital compared to the regional hospital, but it has all the setups to teach all the cadres of healthcare, right from doctors down to whatever professionals.
Okay. So that's when Kolebu and probably
So exactly. So when the mandate to teach is added on, then that is when you call the place a teaching hospital. Yeah. But actually, if you look at it, in reality, almost every health facility will receive students, will train health workers and all that. So we are all teaching.
Amazing. 2019, you came to Effia Nkwanta Regional Hospital.
Yeah.
And then 2020, COVID.
That's right.
How did you take it?
COVID was, that was a terrible time. Probably the hardest time of my life, especially as a leader. from the very beginning, you see, COVID, it wasn't just because it was a public health crisis, but it was a level of misinformation and a level of anxiety and the feeling of helplessness. Because at a point, you didn't know what to do.
Yeah.
You didn't know what tomorrow brought. And the practices kept changing. Today, you wake up and they say that, oh, this is the way to go. The next moment, you wake up and is this
Something
other
different.
So it was a total confusion. There was a lot of anxiety. There was a lot of despair. And as a leader, for me, that was the biggest challenge that I've ever faced.
So Ghana recorded its first case in March.
I think it's somewhere around March.
What about Takoradi?
Takoradi, I think the first cases we saw were in June. It's
June.
either June or July, yeah.
What came to mind the first time you heard that Takoradi had recorded the case?
Fear. I was scared, to be honest with you. We're all so scared. And especially as a leader, you had to lead by example.
Yeah.
Like I said, there was a lot of fear. And amongst our staff, there were people who were not willing to go out there for fear that they will contract the disease and they will die. So we had to set a personal example. So for instance, we had to have a rapid response team, and the leader of the team was myself.
Wow.
And I remember that the first few cases, there were times when it was just one clinician who was brave enough to go out there and see the cases. That was Dr. Ansong. And then later on, others came on board. So anytime we couldn't find Dr. Ansong to see a case, I had to go there myself. You know, because we had to show that example. Apart from the fear and all that, the other issue was the lack of infrastructure. Because at that point, the practice was that you you quarantine the suspected cases, the suspects, until you tested them. And you remember that when we started, the only place you could test the cases was at Noguchi.
Yeah.
So we had to take samples from here, transport them either by our own vehicles or through STC or some other means to Noguchi, and it took on the average about 2 weeks before the results came back. You know, so quarantining these suspected cases, having to feed them, having to take care of them, and we're supposed to take care of them free of charge. You know, so it took a lot of a lot of drain on a lot of our finances, the emotional trauma, the despair. It was terrible. It was terrible. But I'm happy, like I said. But the kinds of leadership, myself and then my management team exhibited, because like I said, we had to have a rapid response team. We had to get people doing things. But above all, we needed to think about when push comes to shove, when we started getting the very severe cases, what were we going to do? So one of the things we did was we had this old structure at our CDU. The CDU is our communicable disease unit. We had to quickly work on that place and convert it into an ICU.
Wow.
And we were successful in that regard with the help of GIZ. GIZ is a German organization. We owe them a lot of gratitude. The whole region owes GIZ a lot of gratitude. And it came from our initiative. Because we went out there, because they did the structure for Ebola in 2014 or so. And then the place was abandoned. So when COVID came, we had to look for GIs, and even getting them, you know, so we had to push, and then eventually they decided to come on board, came to look at the place, and they bought into the idea, and they quickly mobilized. So within, I think 4 or 5 months, we had completed the work there. We had the gadgets in the ventilators, the patient monitors, and all that we needed. So we set up an 8-unit ICU, which I'm proud to say saved a lot of lives in the Western region.
Amazing.
Prior to that, we had to refer all very ill COVID cases to Accra.
Okay.
And you know, one of the problems with COVID is oxygen dependency. A patient with severe COVID is totally dependent on oxygen. And so transporting that patient over a journey of 5 hours, to Accra was well, we lost a lot of them in transit. So when we got the ICU on, it really helped. It saved a lot of lives. And for me, that is one of my proudest legacies. And I have, like I said, my team, a team of management, administration, head nursing, accounts, pharmacy, and the rest of them, the heads of units. They all did a yeoman's job, making sure that we had this situation contained. You remember that when the COVID started, Effia Nkwanta was one of the first places in the region where we got health staff infected. Yes, it was in the news that about 20 staff of Effia Nkwanta had caught the disease. And the interesting consequence of that is that patients refused to come to Effia Nkwanta because they were the caregivers rather became people were scared that they would come to hospital and catch the disease. So our attendances dropped. To make matters worse, because some particular units had the disease, we had to shut those units down, for about 2 weeks or so, and then later on resume. So all that affected us a lot. Apart from the financial drain, the demotivation, the effects on the clients, and all that. So it took a lot of determination to be able to get out of that situation, the manner in which we did. So
COVID, 2 years on, what would you say have been your lessons?
The lessons, well, never to fear. And never to be afraid of anything. You see, I said, as human beings, if we are determined to do anything good, and if we put our minds and our hearts together, we can always overcome. So for me, that was a personal lesson. Awesome. And Effia Nkwanta, the staff in general, there were a lot of outstanding things that people did around that time that, and I'm glad that the Regional Health Directorate gives some awards to some deserving staff. And people got words of praise from management and all. So it showed. COVID for me showed the good side of our staff. It also showed the bad sides, because we saw some people who would not even come to work at all. Yes, people, you would look for them and you won't find them. So it also, apart from teaching us not to fear and all that, it also showed us who is with us and who are not with us. So there was good out of the COVID situation.
So it's been 3 years in Takoradi at Effia Nkwanta Regional Hospital. What would you say has been the success story? What from 2019 up to now? What can we say has been the success story?
Well, so like I intimated earlier, the biggest story from Effia Nkwanta is been the improvement in the staff attitudes. And like I mentioned earlier, we probably are not there yet, but there's been remarkable improvements. People tell me this every day. And from our own research, we interview the clients, and I'm sure a lot of clients will tell you this. that people who come, when they leave, we call them and find out how their experience has been here. And overwhelmingly, we have very positive feedback. Well, of course, we also have, the odd, case here, the random cases of staff misbehaving and all that. But you see, organizational change, it takes time to get there. So we've achieved a lot in that area, but there's still a lot to be done, and we are on it.
I love the fact that you call you call us your clients, because it's only when you see people who work in here as clients, that's when you begin treating them well.
That's right.
And I think one way or the other is helping to change the narrative about caregiving in the health sector.
Yeah.
Still on Effia Nkwanta, what would you say has been some of the facilities that have been put up within these 3 years, within this period?
Good. Okay, so we've added a lot of new services to what we had when some of us came. The first we did was the dialysis unit. These days we have a lot of kidney diseases around, and the dialysis unit was something that previous management had thought about, but hadn't been able to fully set it up. So when I came in and with my team, we felt that we should take that initiative and make sure that it sees the light of day. And God being so good, I think about 6 months after we came in, the dialysis center was inaugurated, and it's still working. A lot of facilities start this dialysis unit and they fold up because of the financial challenges and the technicalities involved. But I think our staff have been good. We've also managed well. And so the facility is still running. So that's the first one. The second thing is converting our patient management system from the manual, the paper, the folder system to the electronic. We did that in, I think we started running the electronic system somewhere in June of 2019. And within about 6 months, we had completely eliminated the paper system from us.
That's really
using a software called HAMS. So that's what. So that's another huge achievement for me. Of course, the facelift, which is obvious for everybody to see, the tower building and then the other wards looked awful. When we came in, we were able to give a facelift to the place. And today, people are proud to even take pictures around Effia Nkwanta. It used not to be like that. So that was something that we were happy we were able to achieve. We also started what we call endoscopy. Endoscopy is a procedure where a camera is passed into somebody, either through the lower orifice down or through the mouth, and then the camera takes pictures of the interior of the person. So we've started an endoscopy unit through collaboration with a private investor, and that unit has been running for about a year now. So that's also an achievement worth mentioning. The other one is a diagnostic center. In the past, if you needed to do something like an echocardiogram, that's like a scan of the heart, you had to go to Accra or to Cape Coast or somewhere like that. If you had to do an electroencephalogram, that's an EEG, and that's something like an electronic scan of the brain. It is done for people with seizures, with epilepsy, brain disorders, and all that. We used to send all those people to Kolebu. We have it here now. We have a place we do spirometry, which is looking at the functioning of the lungs. It's all here. We had Holter ECG, which is a specialized kind of ECG, different from what we know at the emergency. There's so many things that are done there that hitherto you had to go to Accra, Kumasi, or Cape Coast to do them. So that's something that we've also added on to the services. Recently, we've just started test running an ICU. We've set up an ICU, a 5-bed ICU.
Okay.
Very well equipped, and the ICU is a intensive care unit.
Okay.
It is meant for the management of very ill patients, patients who you can say survival is probably 50-50 or less. And we've set up that place. We're currently test running the equipment, making sure that everything is on point before we begin to admit patients. We've also started what we call a referral call management center. Now, the idea is to take calls from referring facilities, because that's our core mandate, to take referrals from the facilities in the region. So what we've done is to acquire a toll-free number, a 0800 number, through which the referring facilities can call us free of charge.
Wow.
Yes, and speak to someone regarding the case they want to refer. Now, that person goes through the case, links up with a specialist in that area, or even the unit where the patient will be received. So they make sure that they prepare the ground before the patient is brought in. They are also linked with the National Ambulance Service, so that the patient's transportation can also be facilitated. So that's what we've started that. Unfortunately, there was a few challenges with the equipment which are being sorted out currently, and I believe that by the end of this week, that center will be fully running. So these are some of the things some of the innovations that we have brought into Effia Nkwanta.
I must really congratulate you for all these, because it's pointing to one thing, that whatever we set our minds to do, we can do. Anytime you hear these controversies around Effia Nkwanta, what comes to mind? Because you're doing a lot of work, and when all these, because there have been recent cases and all that about Effia Nkwanta, what how does that make you feel?
Initially, I got disturbed when I hear some, especially untrue stories being peddled around. But I have also got to learn one thing, that not everybody is happy with progress. There are people who benefit when things don't go right.
There's lack of progress.
Exactly. When things are not working, when the system is down, that is when they benefit. So you don't expect that. You don't expect that they will be sitting down watching us to try and improve the place. No.
True.
So I know that these are some of the things. I would also talk about I would say, the media in the Eastern region. There's a very vibrant media setup. There's a lot of radio stations, a lot of TV stations, and all of them competing for the same clientele. And when there's something like that, you expect that people will try to do a little bit to catch the attention of the public. And Effia Nkwanta, we are like sitting ducks. So everybody can, take us up. It's the same thing with most of the big hospitals. Kolebu is no exception, Komfanochi, and so on. So it is part of the cross we have to carry as big facilities. We are always in the spotlights. And sometimes when people don't even have anything to say, they will try to invent something or blow up a small incident just to make the news. So it's one of those things. So these days I've learned to take these things in my stride and then to deal with them anytime they come up. But having said that, also I would say that I've also had a lot of support from the media in the region. We've been very lucky with a lot of the media houses. they've projected the things that we're trying to do, and I think that in all, it's been good.
What would you say is the future for Effia Nkwanta Regional Hospital?
The future for this hospital is extremely bright. Extremely bright because apart from the modest achievements that we have as a management team been able to achieve, there's also this redevelopment project the government has come up with as part of the Agenda 111. And as we speak currently, the project is underway. Currently at the preparatory stage where the ground is being prepared for the final takeoff of the main construction work itself. And the purpose of the project is to redevelop this hospital into a tertiary facility.
Amazing.
A teaching hospital to pave way for Sekondi Takoradi to have a medical university, which will be training all cadres of health staff, including doctors, nurses, paramedicals, laboratory, x-ray, and you name them.
Amazing.
So it's on the back of this that I say that the future is extremely bright. Yes.
I noticed that you always talk about your team.
Yeah.
You don't take all the credit by yourself, because you give some of the credit to the people you are working with. Are there people you want to you think they are worth mentioning? People.
Yes, I think I've even mentioned some of them.
Mention one, Dr. Anson.
Yeah, Dr. Anson, who is he's currently on study leave somewhere.
Okay.
Yeah, he was doing the coordination of the COVID work. As for the doctors, there's so many good doctors here. Dr. Wusu, Dr. Mensah, the obstetrics and gynecology, Dr. Bacha, child health, Dr. Young, cancer. There's so many of them. And Dr. Khalid, an exemplary physician, and so many others. But with regards to the management team, the people who stand out, my head of administration, Mr. Danso, my clinical care coordinator, Dr. Amihir, Alaji Sadiq, who is my head of finance, Madam Amoyate, she's the nurse manager. She's about to go on retirement. We call her DD1. Yes, I mean, fantastic woman. So I'm blessed with these great people who are around me, who've backed me all along, and it's only proper that when we begin to talk about successes in the hospital, there's no way I can talk about myself only, because it's not been a one-man.
Sure. Before we wrap up with this conversation, maybe you can give us a snapshot of your family, your wife, your children.
Okay, they are actually around. You want them in?
Well,
you want to take a picture of them?
Yeah, sure. We will.
Okay,
After this interview, we would add
yes,
them.
So I have my wife is my beautiful Eunice. She's called Eunice Ameyawofe.
Okay.
And this one I'm learning from the president. He says, my beautiful Rebecca. And then I have 4 kids, Austin, Kendra, Joel, and Bevelyn.
Would you want any of your children to take after you?
Absolutely. If that's what they want. But I would not force anybody into becoming a doctor. But if that's what they want, I'll give them the backing 100%. But I'm very open-minded. So if anybody wants to do anything, if that's their calling, that's what they feel like they want to do, I'll give them the backing 100%.
It's been great having this chat with you, Dr.
Thank you very much, Mr.
Thanks so much for having us.
I'm very grateful. Grateful for this opportunity.
Thank you. Right. Thank you. So it's been a great interview here. Having this conversation with Dr. Tambil, the medical director of Effia Nkwanta Regional Hospital. Keep your eyes on this channel. Don't forget to subscribe. And don't forget to also share with your friends. See you there some other time. Bye.
Yeah.